Hi, everyone. Hi, welcome. Welcome. We're going to get started in about a minute or two. We'll wait till some more people come on. Thanks for joining us this afternoon. If you would like to share where you're dialing in from or joining us from, feel free to post in the comments, and we'll get started in a minute or two. My name is Lynn Hernandez, and I'm with the Desmoid Tumor Research Foundation. Over the next 45 minutes or so, you will have the chance to hear from one of our favorite mental health facilitators, Ashley Williams. Before I introduce you to Ashley, we have a few special reminders for you. And I'll wait a minute or two before I announce them. Oh, somebody here is here from Norway. Thanks for joining us. So as you're probably aware, we have less than 10 more days in September, which as you know is Desmoid Tumor Awareness Month. If you visit our website, you can learn more about how you can help amplify the patient voice and DTRF's mission. Just visit dtrf.org/awareness. You can submit your story. You can read some stories of other patients. There's a lot of great resources on there. Also, in just 2 days, we'll be kicking off DTRF's Together We Will virtual weekend, which runs from September 23rd to the 25th. You, as a patient or a care partner, will have opportunities to learn and connect. Fortunately, there's no cost to attend, so you should definitely join us. Visit our website at dtrf.org/weekend to register. Also, we have another announcement. We are going to be speaking next week to Dana-Farber's Dr. Candace Haddix. We're going to be speaking with her at 6 p.m. next Wednesday, right here on Facebook. Make sure you join us. Our topic will be getting the most out of your consultation and treatment plan. You're definitely going to want to join us for this. So make sure you put it on your calendar. Also, be sure to subscribe to our newsletter at dtrf.org. This way you can stay up to date on all of the events that are taking place and make sure that you're dialed in and receiving the latest information. Okay, everyone, so I think we're going to get started. As I mentioned before, my name is Lynn, and I'm with the Desmoid Tumor Research Foundation. Today, I am here to introduce you to a familiar face. For close to a year, the foundation has partnered with licensed clinical social worker Ashley Williams to bring you a series called Dealing with Desmoids. This is a mental health series, especially for desmoid tumor patients. Today, Ashley will be discussing some mental health tools that you can use as you move through your desmoid tumor journey. This educational program is made possible by a grant from Ayala Pharmaceuticals. Okay, so without further ado, let's bring on Ashley.
Hi, Lynn.
Hi, Ashley. Hi, good afternoon. Thanks so much.
Nice to be back.
Great, great. Yeah, I feel like I'm so used to seeing you, every other month. We have our planning, etc. It's great to be kind of off schedule and to be able to schedule this.
Definitely. I love any time that I can come and join just the Desmoid community, especially in September for our awareness month. It's just an honor to be able to share information that hopefully is helpful and pertinent to our community.
I love it. I love it. So, so before we get started, I just wanted to mention for anyone watching, we really want to hear from you today. Ashley's going to be presenting, sharing a lot of great information with us. I feel so lucky, especially I'm not even a patient and I get to hear this information. So please feel free to comment, and we'll take questions for Ashley throughout the event and after the event. So we would love to hear your comments and questions. So before we get started, Ashley, I want to say upfront, and I mentioned this before, I'm not a patient myself, but I remember when you did your first and second webinars on trauma resilience and post-traumatic growth. And I remember after that, having these one or two things that just stuck in my head. Like I was armed with some measurable things that I could do to facilitate my own healing. And since then, I've been gargling every night because that affects the vagus nerve, right? Am I right?
I love that.
That's what
Yeah.
you taught me. That's what you taught me.
I
So
love that.
yeah, so talk to us a little bit about what you're going to be teaching us today.
Well, I love that you just shared that because it's foreshadowing something similar that we're going to be talking about today, and just the importance of little things that we can incorporate into our daily lives in order to help with the stress and the anxiety and just the overwhelm that can come with our diagnosis. And so today we're really going to focus on 5 different tools that I think are very powerful, but also very simple to be able to incorporate into our treatment plan, so to speak. So, yeah, we're going to start with that. I guess I can go ahead and just jump right in.
Yeah, absolutely.
Okay.
You're on.
Perfect. So as Lynn shared, I have had the opportunity to join with the DTRF and share through the Dealing with Desmoid webinars. And one of the things that we have talked about extensively during those times is just the effect that a desmoid diagnosis can have on our nervous system. And so I want to start off with some strategies that can be really helpful for working with our nervous system and working with our nervous system whenever it gets activated. And so we've talked about this a little bit in the Dealing with Desmoids webinars. And so I'm going to do a brief overview of just how the nervous system is affected by stress and all of the things that can come along with our diagnosis. And then I'll jump into what are the strategies that can help affect that. But first, we're going to talk about the why it's important. So anytime we, oh my goodness, are confronted with any type of stress, whether it is diagnosis related or not diagnosis related, but I think we all know with a desmoid diagnosis, the journey comes with stress. And so anytime we're confronted with any type of stress, our body responds, it reacts, and we immediately go into that fight or flight mode. And our body prepares to deal with the stressor or with the threat that it's confronted with. And whenever our body jumps into that survival mode, a couple key things happen. So the first, our entire physiology changes in order to prepare us to either fight a threat or flee a threat. And how our body manifests that is by tensing up all of our muscles to prepare us either for the fight or to prepare us to run away. And so our blood, our oxygen is redirected to specific muscles, redirected to our lungs in order to give us the capacity to deal with this stressor that's been placed before us. And this is going to be really important later in understanding why we're going to be talking through some of the strategies that we do. Now, whenever a stressor is removed from our environment, then our body can go back to a state of calm and relaxation. But if we're in a situation where a threat or a stressor isn't removed, then sometimes we can live in a constant state of that survival mode, or a constant state of feeling like we are in that fight or flight mode. So we're going to be talking about today, mainly, I think 3 of our 5 strategies are going to be how do we calm down the nervous system once we get into that fight or flight mode. And so the first strategy that we're going to be talking about, Lynn, I might have you join me in some of this.
Yes.
It's maybe a little like, it might feel a little silly, but I just want to encourage everybody who is joining, buy in, try it, because it is a very, very powerful strategy that, while it feels silly, it is addressing all of the sequence of events that happens in our body whenever we're confronted with some type of stress. And so I'm going to be referencing back to the fight or flight system a little bit, and you'll hopefully see how this strategy is interwoven with our natural physiology and what happens whenever we experience stress. So this strategy is called ESHY. It's an acronym spelled ESHY. And this is a strategy that we would use anytime we feel overwhelmed, anytime we feel anxiety, anytime we feel some sort of stress, as a way to productively work through that feeling and then ultimately bring our body back to a place of calm. And so we're not trying to suppress the feeling, we're trying to give it space and room to be felt, but then ultimately regulate our nervous system back to a state of calm. So in this acronym, we're going to be talking about 4 different steps. So E, the first one, stands for exaggerate. Now, when we talk about exaggerating, we're talking about the natural reaction that our body has to stress or overwhelm. And you may notice that whenever you receive some challenging news, or whenever you have a lot on your plate, whenever you're stressed or overwhelmed, the natural reaction of the body is to tense up all of its muscles. We tend to carry stress in different places. Many people carry stress in their shoulders or in their neck, maybe in their hips. And it shows up as sore muscles or maybe painful spots. And often that's because we're carrying tension that we don't realize that we have. So when we're talking about regulating the nervous system, the first step that we want to do is we actually want to give the body what it wants. And so E, exaggerate, means give in to the tension that your body wants and exaggerate it. So Lynn, I'm going to have you do exaggerate with me.
Okay.
On the in breath, this is essentially a breathing exercise. So on the in breath, we're going to do one action. On the out breath, we're going to do another action.
Okay.
On the in breath, when we breathe in, we're going to exaggerate and tense all of our muscles as much as we can. So first, breathe in, exaggerate, and then on the out breath, we're going to throw that tension down. And honestly, I told you this sounds silly, but I want there to be a noise with the out breath, because energy and emotion in our body gets discharged through movement and through like our voice. And so on the in breath, we exaggerate. On the out breath, we go, yeah, good, perfect. And we just let it out. So let's do it one more time. In breath, exaggerate. Out breath. Perfect. So this, again, I'm telling you, may feel a little silly, but we're working with the physiology of our body. I can't say that word. So this step of the process, it may need to happen for a couple of breath cycles. This may not be one breath in, one breath out. It may be a few minutes of every time you breathe in, tensing up all of your muscles, and then when you breathe out, letting it out. Now, when you feel like you have given your body what it wants, that you're giving into that tension, the next step, S, stands for shake. Now, research tells us that research actually looks at animals, and it tends to look at animals first. And one of the things that research is showing us is that animals who literally live their lives being attacked by lions and tigers and other predatory animals, they often don't live a life acting traumatized. And so the research that was done on animals to see, okay, how do they like discharge the stress from having their life constantly be in danger? They found that animals, once they flee a threat, they tend to have muscle spasms or shake, where they literally are shaking off the stress. And so, first, we exaggerate, we give the body what it wants, and then we're going to shake it out. So, perfect. This can be done for just a couple of seconds. I like to throw on a song and just, shake it out while I'm listening to a song that I like. So those first two steps, Lynn, I love it. Perfect. Those first two steps are really about, working with our nervous system, giving our nervous system that fight or flight response what it wants. And then the second two steps are, how do we bring the rest and digest system back online, which is the one that counteracts our survival mode fight or flight system. Now, Lynn, you referenced it earlier, the vagus nerve. We've talked about the vagus nerve in our dealing with desmoid sessions. That's essentially a nerve that runs from the brain to the gut, and it's how our brain communicates with our body. And so that nerve tends to go offline when we experience stress, meaning it's difficult for us to get back to a place of relaxation. That nerve is responsible for getting us back to a place where we feel safe, where we feel calm, where we feel like our stress has been removed. And so since the nerve runs through the back of our throat, like you said, things like gargling can help stimulate that nerve. Something else that can help stimulate that nerve is humming. And so the H in ESHI stands for hum. So after you've exaggerated and you've let it out, you've shaken it off, then humming comes next. So it can be humming a standard tune. It can be humming along with the song that you turn on. But humming is the third step, and that's really meant to reactivate the nerve that is responsible for bringing your nervous system back to a place of calm. The final thing, the Y, stands for yawn. Now, our bodies are built to where when we're in a state of stress or we're in survival mode, our bodies are not prepared for rest. So yawning doesn't happen normally whenever we're stressed unless we're overtired. And so yawning is a strategy that we can use to kind of trick the nervous system into believing and knowing that it's safe. And so the way that we do that is once we're done humming, then we can stretch, twist our body, and do fake yawns until you get to a real yawn. If you do fake yawns until you get to a real yawn, you want to let the culmination of the ESHI strategy be getting you to that place where a real yawn comes up versus trying to force it. Love it, Lynn. Thank you.
That was real. That was real.
I could tell you're doing such a good job modeling this for us. But I told you at the beginning, this ESHI strategy, it feels a little silly. And these steps can all feel a little silly in sequence, but it is a powerful, powerful strategy for being able to actually facilitate the stress that we're experiencing in our body. And so we're not just trying to get rid of it, we're trying to honor it, give it some space to be able to be felt. We're feeling the tension that it's bringing, but then we're trying to regulate our body and our nervous system to a place of calm. And so ESHI, again, E is for exaggerating, muscle tension, throwing it down. S is shake it out. H is for humming. And Y is getting to a place where you can get to a natural yawn. Make sense?
Yeah, I want to jump in really quickly.
Yes,
because what comes up for me around especially the exaggerating and the shaking is that these are like in public, these are things that people do not do. These are not like, it's not acceptable to like breathe out loudly. It's not acceptable to like shake in a non-dancing way. And if you Google I'm sure you've done this before. Google shaking on YouTube, and you will see people intentionally shaking to relieve the
Yep.
stress. And it's
Hmm.
uncomfortable for some people to watch and some people to do.
Yeah.
So it's so cool that you're bringing this up, because I feel like we walk around like robots. Like, you
Yeah,
sit
we
this
do.
way, you only move this way. And I love this because it feels very intentional and unorthodox, and like, yeah. So thank you.
Thank you. Thank you for mentioning that too, because that's why I preface so much. Like, I know this feels silly because culturally, this is just something that feels very foreign and feels very strange. But the reality is our stress and our anxiety and our overwhelm, we carry it in our bodies rather than in our brains. And so it's not something that we can necessarily cognitively remove ourselves from. It's something that our body needs the opportunity to work through. And so some of the strategies we're going to talk about next are ones that we can do in public. This one is for when you're feeling really overwhelmed or when you're feeling really stressed out and you need, like, the just intensity is there. How can I move that through? And excusing yourself, going to the bathroom, going home, doing this in your room, wherever you feel comfortable, so that you can fully experience all of the pieces of it is going to be the most beneficial. But we have some other strategies that maybe, like, if you're at work or you're at the grocery store, you're in public and you don't feel comfortable doing this one, we have some other ones to help us regulate our nervous system and get back to a place of calm. So I'll jump into the next one.
Yeah.
So similar to Eshi, I mean, we're talking first here about regulating the nervous system. And so one of the main strategies that we have within our ability is the way that we breathe. And we've talked about breathing several times in the Dealing with Desmoids, but I want to give one specific strategy that is very, very powerful for helping to regulate the nervous system. This is a strategy that is taught, it's been taught for centuries. It's taught currently to our veterans in the United States whenever they're in combat, just how to help keep their nervous systems calm. I recently went through radiation, and during every radiation treatment, whenever I knew I couldn't move and like I had to sit still, I was doing this box breathing technique to keep myself calm throughout the process. And it's something that really works. And so, this next strategy, the second strategy for today, is specifically box breathing. So, with box breathing, the reason it's called box breathing is because there's 4 different steps of equal length, as if you're following the lines of a box. And so, with box breathing, the first step would be you inhale for 4 seconds, you hold that inhale in your lungs for 4 seconds, you exhale for 4 seconds, and then you hold that exhale for 4 seconds. So, Lynn, do you want to do it with me?
Yeah, absolutely.
All right. So, inhale, hold, exhale, hold. Inhale, hold, exhale, hold. And just following that pattern for however long you need to. You can use the hand movements if you need to in order to keep the timing, but this is something that you can just do to yourself as well. But it's a really powerful strategy for being able to really, like, manually override that survival mode instinct that comes up, that fight or flight instinct that comes up, and manually tell our body, you know what, it's okay, I can calm down in this space. And so using it to really help combat anxiety that's coming up in the moment, maybe overwhelm that's coming up in the moment, maybe even fear that you're feeling if you're walking into a treatment or a procedure or a a public speaking engagement at work or anything really. This is a powerful strategy to do in the moment as you're preparing for something that you know might bring stress and anxiety. Any questions on that one?
I really love that. Do you have, I think that you've mentioned additional breathing techniques that you've used. Can you mention some other ones?
Yeah, there's a lot of breathing techniques out there, and it's kind of fun if you have the opportunity to even maybe look up some online and see which ones work best for you, because there are going to be different strategies that help target different things. One that can be really helpful, that you can do anywhere. And Lynn, you just said, like, maybe this isn't the most socially acceptable thing, but I feel like I do this all the time, is even just intentionally sighing. And so even breathing in and letting it out. I just walk around, and sometimes I'm walking around and I find myself, and people ask me all the time, they're like, "Are you okay? Like, what's wrong?" And I'm like, I'm just regulating my nervous system. I'm totally
Is that what you say?
I do, because even for me, like, I have a difficult time tolerating caffeine. So even if I have too much caffeine and I feel the anxiety coming from caffeine, I use that one all the time of just like, okay, like, let me sigh, let me get it out in a way that actually there's some sound coming out with my out breath. But that's something that can be really, really powerful as well. There's another one that I recently learned from a friend of mine. It's something called fog breath. And this is even breathing in and breathing out. And on your out breath, it's like you're trying to fog up the mirror in your bathroom. And so it's like, this is going to be real intense in the microphone. Yeah. So you'll notice with each breathing strategy, it does feel a little bit different. And so there are different sensations that you carry. There's maybe a different feeling of like letting things go or letting things out. And so those are some powerful ones that we can use. And I really recommend people looking up different breathing techniques online and giving them a try. I'm a big fan too, I hope this is okay to say, of different yoga practices. And on YouTube, there's some free yoga practices by this teacher. Her name is Yoga with Adriene. And she has a specific 30-day practice that's just focused on breathing. And so even that, there's some yoga moves in there. They're not super strenuous, but a lot of it is focused on different breathing techniques. And so if you're looking for maybe a yoga practice to pick up for the next 30 days, Yoga with Adriene, her breath exercise is a really, really good one to try on all of the different types of breathing exercises and see which one works the best for you.
Oh, that sounds great. That sounds like
Yeah.
a great resource.
Yeah, I love her. So the next strategy is one that I love, and it's so simple. And it's something that we can use at work. It's maybe something that you can use this weekend if you're attending all of the webinars in the Together We Will weekend. It's a lot of anytime we have a lot of sitting to do and we feel like we're holding that tension within our bodies, what we're trying to do in regulating our nervous system is really just trying to relax the muscle tension. And so this third strategy is something that I call the wet noodle. And the wet noodle is essentially just sitting back in your chair and pretending like you're a wet noodle, like just completely letting all of the tension go from your body and sitting in a way where you're not having to tense up your muscles, you're not having to carry any of that stress, just being really intentional and aware of, let me just relax everything. So anytime we find ourselves sitting for a while, anytime we find ourselves maybe in a waiting room and we feel the stress or the tension rising before we go into our appointment, the wet noodle is a very simple strategy, but truly, even if you try it at home right now, like, it's a very effective strategy. I just want to stay in this position, you know?
I'm having a hard time doing it because I don't have a headrest. So I'm like, oh, but I love that.
Even like slouching in your chair and like, I don't know, whatever you can do to find like letting the tension go. You don't have to try this one. Don't worry. But that one can be a really simple and surprisingly effective strategy. So I don't know if there's any questions on that one. That one's pretty straightforward, I think.
Yeah, I think that one, yeah.
Perfect. So our fourth strategy, we're going to move from strategies for like regulating our nervous system, maybe to some cognitive like brain strategies that we can try in helping to process all of the things that we go through as a desmoid patient. And the one of my favorite things to do, I recommend this to everybody, is journaling, and specifically the strategy of therapeutic journaling. And I'll explain what that is. But first, with journaling, we process information from different parts of our brain whenever we're verbally processing. So, like if I'm talking to you about an experience that I've had, I'm processing that in one part of my brain. But if I write it down and I journal about it, I'm processing it through a different part of my brain. And so, to have the opportunity to verbally process our experiences, coupled with journaling through our experiences, can be a really, really powerful way to make sense of all of what we've gone through. And so I would recommend developing strategies to help regulate the nervous system first before entering into a journaling practice. But journaling can be a really, really powerful way to make sense of our experience. Therapeutic journaling specifically is I'm going to take the pressure off of the outcome of what I produce. Because if you're like me, I'm the kind of person where I didn't journal for years because my thought was, well, if something happens and somebody finds this journal, it better be like a publishable work, like I better like have something that I can produce that's just very, very profound, right? I hope I'm not the only one who feels that way. But therapeutic journaling, the goal is essentially take the pressure off. Once you're done journaling, you can keep them or you can rip it up and throw it away. The actual physical written out work is not necessary. But therapeutic journaling is turning on a timer for 15 minutes, giving yourself space for 15 minutes. So it's time limited. You know how much time you're going to be dedicating to it, and writing stream of consciousness. And so stream of consciousness is whatever is on your mind at the time. You could be writing. Ashley on the Facebook Live today told me that I should. If that's what's on your mind, then write that out. And so it doesn't have to be anything profound. It doesn't have to be anything super significant. If you start writing about, let's say, a doctor's appointment,
Are you there, Ashley? I think that Ashley may have frozen for a second. Just see if she comes back on. Oh, I think she may have cut out for a second. Okay, everybody, I think that Ashley will probably be back in another minute. But if, like we mentioned before, oh, and here she is.
I don't know what happened. I'm so
Here she
sorry.
is. Oh, it happens. Don't worry. Don't worry. So you were talking about
I don't know where I was.
So you were talking about therapeutic journaling. You were talking about the
Yes,
benefit of.
and essentially just giving yourself that 15-minute time frame to write stream of consciousness, but taking the pressure off of what you produce with the final outcome. And so just allowing your mind to wander wherever it goes. And sometimes this method of journaling can feel maybe unproductive, because if I'm writing something, shouldn't I be writing about a specific topic? Shouldn't I be writing where it makes sense or it's cohesive, or like if somebody else were to read it, it would make sense? But therapeutic journaling just takes all of the pressure off. And for 15 minutes, you write what's on your mind. It doesn't have to make sense to anybody but you. It doesn't even have to make sense to you. But being able to get it out on paper helps us process the information in a different way. And it's surprising once you start engaging in a therapeutic journaling practice, how effective it can be in helping to process our experience.
I'm really glad that you're kind of emphasizing the writing, because there was a point in time where I would do journal entries via dictation on my iPhone.
Mhm.
And I thought somehow that that was pretty much the same thing, and that the most important thing was that I was getting it out. What
Yeah,
I'm hearing you saying is that sharing things verbally, valuable,
yeah,
sharing things in writing, valuable in a different way.
exactly.
So if I'm talking, that's great, but the idea of actually writing everything out it's benefiting me in a different way.
100%. And you can still use an electronic device. And so even if you have the notepad on your device and you're writing out notes, just the process of having your words written down, you're using a different part of your brain. And so you're exactly right. I'm glad that you mentioned that of verbal dictation is still verbally processing. Instead, we're trying to process things that aren't verbal. And so really taking the time and the opportunity to journal or write things, actually write words down.
Okay, I appreciate that. um okay, so that's all the questions that I have for that one.
Okay, perfect. Another thing that could be valuable in journaling, if stream of consciousness is difficult or if it feels like it's not being very productive, there's a couple different prompts that can be used too to maybe help make sense of the same experience. And so let's say, again, I had a doctor's appointment that I am trying to process and make sense of. I might do some therapeutic journaling, the stream of consciousness journaling, for a couple of days. If I still feel like things aren't making sense, I still have to process like this experience. Some additional prompts that could be helpful are taking that 15 minutes to write a letter. Pretend like you're writing a letter to the doctor. Pretend like you're writing a letter to your tumor. Pretend like you're writing a letter to your future self or your past self. You might want to write a prompt like a fairy tale, like putting your experience in words as if you were writing a story or a narrative or a fairy tale. You could do it also from somebody else's perspective, maybe writing as if I was my caregiver or writing as if I was my doctor. And so the therapeutic journaling, the 15 minutes of stream of consciousness, that's the one I tend to go to and I tend to recommend to others because it just takes a lot of the pressure off and helps us to maybe get to some of our thoughts and feelings that we don't tend to allow ourselves to get to. But if that's difficult, there are a variety of other prompts that we can try that help us look at our situation from different perspectives. And so that might be the perspective of another person, that might be the perspective of, like, if I could write a letter to my tumor. I know that sounds like a weird prompt, but if I could, like, what would I say? And those types of things might help us tap into other feelings and emotions that we don't normally access or we don't maybe even know that they're there. So, journaling in all different facets can be a really, really powerful strategy. The fifth strategy is social support. And having social support and really investing in our relationships is so important for walking a long process like a Desmoid experience can be. And one of the things that I really want to encourage within our community is just the benefit of educating our community on our experience. A desmoid tumor, as we all know, is very, very rare, and a lot of people haven't heard about it. A lot of people don't understand or realize the types of things that we have to go through. And most people's context is more like traditional cancers or maybe chronic illness. People are typically trying to put our experience into some sort of box. And I think as a Desmoid patient, there's not really like a box that we fit into. And so this can have it can create tension within our relationships because it can become difficult for people to understand our experience. I mean, it's even difficult for me to understand my experience as a Desmoid patient half of the time. And so, educating our community, educating our support system on desmoid tumors and what it's like to have a desmoid tumor and what our experience is like is such a valuable piece in maintaining a supportive community around us. There have been so many times, I'll just call myself out, where people have made comments that, like, well, at least you have the what did they say? At least you have like the chemo that's not as strong, or at least you have the good kind of cancer. I've heard that a lot. And sometimes those kind of comments, they hit like, oh, like, don't you not realize what I have been through? Like, this experience can be really, really hard. And it's easy to take offense at those types of comments. But my biggest encouragement would be really taking an opportunity to educate our support systems on what this experience is like and really assuming positive intent from our community, because people just don't know and they don't understand. And I know that it is an extra responsibility on us to educate our community, but I think it is such an important piece. But tied in with that, I think it's also really important for us to be able to connect with other people who just get it and get our experience. And there are so many different avenues and ways for a desmoid patient to connect with other desmoid patients.
Mhm.
There is a great, avid, encouraging, supportive community on all different social media platforms. But even what we're leading up to this weekend with the Together We Will weekend and all of the webinars that are going to be happening and all of the opportunities for patients to be able to connect, it is just such a like breath of fresh air. It's so refreshing to have these opportunities and these mechanisms and these ways to be able to connect with other people who just get what it's like to live with our experience. And so finding community within the desmoid community, but also educating our support system on what it's like to live with our diagnosis. Those are two really powerful components of developing a support system and developing a community around you. And when we're talking about mental health tools, our support system, in the research, it comes up all the time as the number one resilient strategy for being able to deal with stress, trauma, overwhelm, and anxiety. And so, really looking at the people that are around us and helping them know how to best support us is really important.
Ashley, you're wonderful.
Thanks, Lynn.
Thank you so, so much.
Thank you for
So you
having me.
just gave us some five great tools that I think that, I mean, they all feel really tangible and possible.
Mhm.
And I think that that's so helpful, and I think will be so helpful to the community.
Awesome.
We appreciate that you've been so committed to the patient community this year. And I hope that someday I'll be able to meet you in person
I
at
know,
some
it'd be
point. Would be
wonderful.
amazing.
Well, thank
Um,
you so much for having me. Thank you for giving me the opportunity to share with my community and connect with my community. And I hope that some of these strategies are helpful. I encourage you to just try them, buy in, see how they feel, play with them. But yes, very thankful to you, Lynn, for the opportunity and to the DTRF to continue talking to our community. It's been wonderful.
Absolutely. All right. Thank you so much, Ashley.
Thank
I'd like
you.
to mention to everyone again that this educational program was made possible by a grant from Ayala Pharmaceuticals, and we absolutely thank them for their support. I'd like to also make a few more announcements before we close. Just going to be kind of reiterating what we talked about before. This is, as you know, September is Desmoid Tumor Awareness Month. Please visit our website to learn more about how you can spread awareness about desmoid tumors. I thank Ashley for also for mentioning the virtual weekend, which is wonderful, which is going to start on Friday and run until Sunday the 25th. You can register at dtrf.org/weekend. There's no cost to attend, and we hope that you join us for that. Also, there was a comment for you, Ashley. Lisa says that we very much appreciate you. She sends her love your way. So also wanted to let you guys know that next Wednesday at 6 p.m. Eastern, we'll be having a conversation with Dr. Candace Haddix from Dana-Farber. We'll be speaking to her right here on Facebook, so please make sure to join us. So many announcements, it just blows my mind. Make sure that you register or subscribe to our newsletter at dtrf.org so that you can stay up to date on all of the great events and happenings happening within the community. And then last but not least, make sure that you follow us on Instagram and Twitter at DTRF or DTR Foundation. And I think that's pretty much it. So Ashley, thank you so much again.
Thank
and
you.
everybody, make sure that you stay tuned because Ashley's going to be with us again for our next Dealing with Desmoid session, where she's going to tackle another mental health topic that is relevant to the community. So please stay tuned for that. All right, everybody. Thanks so much, Ashley.
Thank
Have
you,
a great
Lynn.
night.
Everyone. I'll see you
Bye,
this weekend.
community. Sounds great. Bye-bye.